think I'm going to go off with this. Okay, so apex is the tip, the base is the top up here. Pericardial sac, there's just a little tiny flap left right here. Not very much.
There's two though, that would be the right one.
Epicardium is just the tissue out here on the external side of the heart. Myocardium is the internal. This is the muscle of the heart. If I were going to pin it, I would ask, specifically, what is the muscle that I'm pointing to?
And we would say myocardium?
Yes. Endocardium is the tissue of that lines the ventricles. So if I were to pin that, I would either ask for the space or I would ask for the tissue. Tissue being epicardium.
And the space would be...
Or endocardium,
Yeah.
Endocardium.
So, and what we say for space? Just ventricle?
Left or right.
Okay.
So in the heart, left and right is very important. Intraventricular groove is, I'm not going to really be able to pin that. It's just this groove on the outside of the heart that separates. When it's closed, you can see that it separates. But I'm not really going to pin that. The left atrium is just this little wing flap. It's on the left side. Right atrium, little wing flap. The smaller one, it's on the right side. And the right one is always kind of like clumped in. Ventricles, left ventricle is the bigger one. This is it. So this is the bicuspid valve. And then this would be the atrium, the left atrium right here. So left is bigger, right, this is smaller. So that's the right ventricle that goes into the right atrium. So again, bicuspid valve, tricuspid valve, and then the chordae tendineae are these little cords. I would have the pin weaved through them. And then, actually they're even better on this side, really big. Then the papillary muscle, right here that they're connected to. From the left ventricle, you're going to see the aortic semilunar valve, which is this big flap of skin right here. It opens into the aorta, which is the middle one. The pulmonary semilunar valve is inside the pulmonary trunk. And it's right here. And it's again it's the same type of flap of skin. It's just inside the pulmonary trunk right here. So this is a pulmonary artery.
So I would assume it's this one, but that's down though.
The superior vena cava is just behind it. The inferior vena cava
Those ones your fingers touch in?
Yes, your fingers will touch in the middle. And then this is the pulmonary veins. Right here and here. Right here. So usually there are 4 of them.
And which one's the aorta and the pulmonary trunk?
Aorta, pulmonary trunk.
Okay, and this one?
Pulmonary artery.
Artery. Aorta, okay.
And that's about it. So what's important is if you know the right from left, if you know left has to be big. Oh, this is interventricular septum. So if I were to pin here, I'm asking interventricular septum. If I pin out here, myocardium. The muscle around the left ventricle is much thicker than out here on the right. Because remember, the left has to pump out the aorta and bigger. So if you're looking at this little flap and you can't remember if that's the aorta or the pulmonary, just think, well, this is the left ventricle. All this big muscle squeezes and pumps it out the aorta, therefore it must be the aortic semilunar valve. But that's about it.
Can you open it?
Mm-hmm.
So it's the aorta is the hole that you can see through,
Yeah.
and then the pulmonary arteries.
Mm-hmm.
Okay.
Yeah, this one.
So, no, but that might be the mesenteric then. Yeah.
And this one goes into right here. It drains into the atrium.
Ma'am, what is where's that at?